Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni. Let's look at today's top headlines. With the strict bond terms, Rajasthan in-service PG Medicos facing trouble getting study leaves. With the state government turning strict for the implementation of bond service rules, the Rajasthan-based in-service MBBS doctors who have been selected for PG courses are facing troubles for getting study leaves. Already pointing out incomplete and improperly filed bonds, the State Health Department has released a list of 12 candidates asking them to submit properly filled bonds in order to get study leaves. This is the result of the government's recent policy for strictly implementing the bond conditions from 2022. Accordingly, the method to scrutinize the bonds filed by the selected PG candidates has also become stricter from this academic session. Private medical colleges call NMC fee order arbitrary, High Court concerned over the admission of unworthy candidates. While considering the pleas filed by the private medical colleges claiming the National Medical Commission fee order for 50% medical seats as arbitrary, null and void, the Madras High Court recently expressed concern over the instances of admitting unworthy candidates for only monetary gain. Referring to such practices by the private medical colleges, the High Court bench comprising of Chief Justice Munishwar Nath Bhandari and Justice N. Mala observed that any other course we can compromise, but if we are compromising on medicine, we are compromising on ourselves. The High Court bench has decided to consider the matter concerning the NMC fee order for the 50% seats on 16th of August 2022. In Gurugram, a brain-dead woman helped save 4 lives. A 60-year-old woman who was declared brain dead after suffering an intracranial hemorrhage gave new life to at least 4 persons after her family members agreed to organ donation at Gurugram Paras Hospital. The woman was admitted to the hospital on 7th of July and the doctors declared her brain dead on 10th of July. The same day, her family members gave a nod for organ donation, hoping that she would still live through her organs. Once the family officially consented to donate her organs, both her kidneys and eyes were allotted by the National Organ and Tissue Transplant Organization. Johnson & Johnson will stop manufacturing its talc-based baby powder from 2023. Johnson & Johnson said that it would discontinue its talc-based baby powder globally by next year. The healthcare products company discontinued its baby powder sales in the United States and Canada 2 years back. The move comes after thousands of lawsuits were filed against the company by several women who claimed that the talcum-based powder contained asbestos and many of them developed several health issues including ovarian cancer. However, Johnson & Johnson has always claimed that its products is safe to use. In a statement, the company said that it would release an all-cornstarch-based baby powder soon. Johnson & Johnson faces about 38,000 lawsuits that claim its talc products cause cancer due to contamination with asbestos. 8 doctors held guilty of negligence. Medical Council slaps 100 CME credit hours penalty for license renewal. Holding 8 doctors working at a private hospital based in Dehradun guilty of medical negligence, the Uttarakhand Medical Council has directed them to undergo 100 credit hours of medical education before applying for renewal of their license. The doctors have been found guilty while operating on an 86-year-old patient who died after his surgery as he suffered from advanced lung disease. Apart from issuing warning to the doctors under Section 21(2)(a) of the Uttarakhand Medical Council Act, the council also held the chief operating officer and MD of the private hospital vicariously responsible. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.